Welcome back. It's now just about 8:30, time for us to get into your health segment. And today we're talking about your oral health, your dental health. And today, just in case you didn't know, is World Oral Health Day. And I'm told after that you have to say ah. So please say ah to the TV or the camera, but there you go. Anyway, joining me to do that is Dr. Mercy Oira Abenga, who's a dental surgeon. Good morning. And thank you for joining us. And dental health, that's an area I know many people would rather avoid when they can, because going to the dentist is not always easy. But maybe let's start first of all with a general overview. We're not just talking about teeth here, we're talking about dental health. What exactly is dental health, and what should we be looking out on this day?
So we are talking about oral health. Basically, it's the well-being or the condition of the teeth, the tongue, all the structures in the mouth. We want you to be in a good condition, healthy condition, so that you're able to function properly.
Okay. Now, there are certain foods I believe that would give us healthy teeth. And these, maybe we should start right from the basics. If somebody has a young one who's growing up, what are the things that they need to be wary or careful about feeding their children so that they end up setting them up for a healthy oral life?
We have, we have various foods in our diet, the carbohydrates, the proteins, all of them. We encourage our parents and the guardians to offer their children non-cariogenic diet. This is food that is not high in sugar. Okay? So when you have children, it's really advised to monitor what they are taking.
What they're taking.
Whether it's break time, whether it's lunch time, what are they taking? And even included with the diet is the water. What kind of water are you drinking? Because we have some places where there's a lot of fluoride. Like the water is very salty, so it actually affects the structure of the teeth.
Is there a way of monitoring and knowing whether it's high in fluoride? Because unfortunately, most people discover when your teeth begin to brown.
You see, that is supposed to be the government's duty. They're supposed to actually regulate all these areas. But unfortunately, they have failed us. So people just move in. Areas like Kitengela, areas like Nakuru, they have a lot of salty water. So as a parent, you're supposed to have separate water for drinking, separate water for cooking, such that what you're ingesting doesn't have a lot of fluoride that will actually affect the structure of the teeth. Especially when the children are growing, that is between 0 to around teenagers. At least that's when the teeth are developing. Okay. And once they develop, it's irreversible damage.
Irreversible.
Yes.
All right, and maybe this might be too technical, but you could tell me if it's something you know or not. Is it true that borehole water generally is very high in fluoride?
Yes, most boreholes, because you see, it's about the regulation.
Right.
So if it has been, the way they test, those people who do their thing, once they test and there's actually a way that borehole water can be treated. We have different filters that have come up that you can actually put in your borehole so that you can reduce the content. Okay, but generally most borehole have salty water.
So that needs to be checked. And one wonders, of course, if there are places, labs that one can take the water to be tested, so that you're careful. But okay, there's a question that had come in earlier from one of our viewers, and this was to do with a young one. At what age should teeth begin to be seen, in toddlers?
For children, we're talking about from 0 years, okay? So children start having their teeth come out inside the mouth from around 5 to 6 months. So that's when you'll see the lower central teeth, the lower front teeth coming out 5 to 6 months. But also, children have different milestones. So it depends with the way your child is growing. So from around 5 months, that's when the baby teeth start coming out, and they are 20 in number. Then we have now the permanent teeth, which will start coming from 5 to 6 years.
Okay. And where there is a delay, should I be concerned as a parent, and what do I do?
Usually, it is always good to seek an opinion.
Right.
Seek an opinion from a health professional, that is the dentist. That's why we are here, to help you. We can always examine, and then we can assure you if there's no problem. We also have different x-rays that we do so that we are able to see whether the teeth are there or they are missing, congenitally missing completely. Yeah.
Okay. Now, you talked about, not eating sweets and not having very sweet stuff. And tell us if it's myth or fact that when you actually eat sweets, they spoil your teeth. And if they do, how do they actually spoil your teeth?
You see, when we're talking about the health of the teeth, we are talking about the diseases that affect the teeth. And chief of them is the dental caries, which is cavities in the mouth. There are risk factors that are associated with this disease. And one of them is the diet. And this diet, if it is high in sugar, when we're talking about sweets, cakes, biscuits, a lot of these
things that are high in sugar.
High in sugar, you see. When the child is taking these foods, and then it's for a period of time, for example, maybe, okay, I can't estimate the time, but for a certain period of time, okay? Right. And then we have now bacteria in the mouth. Normally, everybody has a normal bacteria. But you see, when they find this food, it's a substrate for them to feed on, and then that's how they will break them down, forming acids that will now destroy the teeth. Okay. So it's actually a whole concept on its own.
On its own, and therefore sweets are discouraged. However, if somebody has a craving for them and you eat them, how do you take care of your teeth after that to ensure that you don't get the cavities?
We advise people at least to take these foods near meal times, okay? Because we are advising people to brush their teeth at least twice every day. Okay, in the morning and in the evening after meals. So if you have to take something sugary, take it maybe breakfast or maybe supper time.
So right? That you'll have time to clean it.
To clean it, yeah. Because there's no secret about it. It's just oral hygiene. How are you cleaning your teeth? Are you taking your time? It's recommended at least 3 to 5 minutes. But people just brush in a hurry. You just want to go to work and do your thing. It's not really a priority. It's just a small part of the body. But if you could actually take time and brush your teeth, use a good toothbrush, your toothbrush should be there not more than 3 months, okay? You change your toothbrush
every
regularly.
So often. And maybe advise us, because I remember when we were in school, when we were growing up, there are times we'd even have practitioners that would come into school and literally teach us how to brush our teeth. I don't think that happens anymore, but one might take it for granted that everybody knows how to brush their teeth properly, but that might not be fact.
Well, we as dentists have programs that we go to different schools, institutions. We teach them about brushing and oral hygiene. We also have like Kenya Dental Association. We really do a lot of outreach programs.
What's the proper way of brushing your teeth? Because one might assume that everybody knows, but it could just be, the minute you feel that toothpaste and, gargle a bit of water and you're done.
So we're talking about brushing using circular motion. All right, like your brush, or can I say rotatory motion? You're brushing along the arch, the tooth, where the teeth are, and looking at the mirror so that you are able to see whether what I've brushed has actually come out. Okay. We also have interdental cleaning methods like dental floss. Okay, interdental brushes. Okay, we use them to clean in between the teeth, areas where the brush doesn't reach. Okay, and then now a gargle or a rinse after.
Okay, how effective are mouthwash? I forget what they're called, mouth cleaners. They're these, mostly they're blue or red or whatever that you just, put in your mouth, and they're normally pretty curly for a few seconds, gargle them. How effective are they? Can they replace brushing?
No, it cannot. It's just a liquid that has a sort of an antiseptic and some antimicrobial properties to kill the bacteria. It normally helps especially with bad breath, okay? But the causative agent has to be removed, which is food on the teeth. So once you have brushed is when the mouthwash can actually be an add-on, but shouldn't replace.
Okay. Now for somebody who has brown teeth because of fluoride, is that reversible? Is there anything that can be done to have them back white?
When we talk about like discoloration on the teeth, the condition you're talking about is dental fluorosis, okay? We have various treatment options for that, okay? We have something we call masking, dental masking, whereby we cover the tooth surface with a white filling material, okay? Such that only you and me know that there's something on the tooth surface, okay? It's very good, especially for children, basically 0 to 18 years, right? There are also more permanent solutions. We have something called a crown, right? Something, a sort of a cap we put on the tooth that covers it entirely, and it's white in color, so nobody can see the brown discoloration. As of right now, we are not able to reverse the brown discoloration.
Once it's brown, you can't polish them to become...
It's really difficult, unless it's very, very minor. But most of the time, it's a very severe. Depending on the category, we also categorize this condition. But for the most cases, we have to really hide. It's like we are covering it up.
Literally cover it with a crown or something.
Yes.
What about things like plaque, when you have black spots within the teeth, which are not necessarily fluorosis, but maybe out of just negligence or not proper brushing of teeth?
Usually tooth discoloration has very many causes, yeah? And chief of them is the food, the diet that we take. Usually it's on the outer surface. It's called extrinsic staining. So we are able to clean that out by a procedure we call full mouth scaling and polishing. We clean out everything, yeah, such that your teeth now retain their natural color. All right, they're not becoming whiter. They're just gonna be now the normal
color,
white color. All right. And now we are able to also eradicate gum disease, because that food debris that hides there in between the gum and the tooth is what causes the gum disease. Yes.
Okay, then we come to pains that sometimes we have within the teeth, and I know we'll go to the gums in just a bit, but at the point where I begin to feel pain at certain teeth, when I'm eating maybe something sweet or small objects like rice get into that, should that be a matter of concern?
Yes. You see, most Kenyans, they wait for
that time.
like when you can't sleep is when they will come to the
and then
dentist.
They'll be the first ones at the dentist.
Yes, and they're like, it's an emergency, you know, I can't go to work. Yeah. But if you follow the ideal recommendation, whereby you go to the dentist at least every 6 months, they are able to check your teeth. If there's a small cavity or somewhere that is already ditching, we're able to put a filling, clean out all that debris and fill it up. Okay, we also do x-rays so that we're able to see exactly where the cavity is. All right. So advice to Kenyans, please let us embrace the checkups. Let us not wait until it is severe pain. All right, such that it has really destroyed the tooth surface. Though in our current generation, we really try to preserve the teeth as much as possible. So we'll do fillings. We have something called root canal.
Right.
All right. And if it is really bad, like hopeless now, prognosis now is when we remove the
you
tooth.
Extract.
Yes.
Okay, and walk me through the root canal, because that's normally a very scary exercise for many people. I have experiences which I don't want to share right now, but there have been experiences which are not very nice. But are root canals ideally meant to be as painful as they are? Is there technology that has brought us to a point where you can actually sit through a root canal and you're okay?
Yes, of course. Root canal is a treatment whereby we are aiming to preserve the tooth, right? We want you to function.
And this is one that maybe has very deep cavities.
Yes, you see, depending on the extent of the tooth, yeah? Like you'll see in children, almost 46% of them have cavities. In adults, it's even higher, 70-something% of the people have cavities, yeah. So depending on the extent, we're able to see, okay, this one will require a root canal because it has exposed the inner tissues, the blood vessels and the nerves. So root canal, we are cleaning out all that infection, all the debris, all the food that is there, and the nerves and everything, and then now we replace it with a permanent filling material inside the root and also on the top part, right, the crown.
So ideally what you're saying is that with the root canal, that tooth is actually dead as it were, but still remains in place.
Yes, please.
Instead of putting another tooth.
Instead of removing and then now replacing with an artificial tooth. Artificial tooth is not the same as your natural tooth. So you should try and preserve your tooth as much as possible. Yes.
Okay, so in terms of the process, does one have to be under anesthesia of the whole body, or can it be local anesthesia and still work?
Yes. We actually have different techniques of administering anesthesia. So once the doctor does the anesthesia, you're not supposed to feel any pain unless it's really infected, of which we'll give you some medicine so that we can eliminate the infection. Okay. Yeah, so it's not usually painful, and the technique have developed even better instruments nowadays so that we're able to remove the infection completely. And after the filling, you don't feel any pain.
Okay. Now take me through generally what our day should be when it comes to oral care. How do we go about it? Like a normal routine for the day.
A normal routine? Basically the brushing. I'm talking about the brushing. You wake up in the morning, of course, take your breakfast. Then after breakfast is when you brush your teeth, right? Avoid so many sugary substances in between the day.
In case I have sugary stuff, and this could even be something like tea, coffee that has sugar, would maybe gargling water help? Does that help too?
It's not bad to have sugar in your tea or something. I'm talking about like sweets, you know, constantly chewing gum, right? Even if you do a study of children who are always taking sweets and all that, versus the ones who have a moderately natural food like, ugali and yeah, you can't compare. Some of them really have a lot of cavities in their mouth.
Right.
Then in the evening, of course, remember to brush after.
Brush your teeth. Yeah. All right. And maybe just general overview. Today is World Oral Health Day. Affordability, again, becomes a little bit of a problem for many. And that's why you'll find that most of them come when the pain is too much. Because there's this imagination that dentists are very expensive. Is that necessarily true? And are there options?
I can't speak for the population, but I can say for the dentist side, well, our equipment are very expensive.
Is that what makes it expensive?
Yes, because you have to compensate for the costs that you have undergone. But generally, we have insurance covers. Nowadays, people have dental cover, right? And you can always come up with a payment plan with the dentist. Tell him I'll be paying slowly by slowly, Don't stay in pain, and we are here, we can help.
What is your advice on, we know that there's regular toothbrushes that we use, but what's your advice on, I've seen some that we get that are, I think it's a type of tree that you use, and you're able to go about your day basically just using that. Is that advisable?
We do not advocate for the sticks. We do not advocate for that, unless it's really like you don't have another option, okay? But we really advocate for the toothbrush and the toothpaste.
What makes the toothbrush better than, my traditional toothbrush, which I still would use? And
you see the stick, first of all, the mini sticks inside are hard, all right? So they cause a lot of trauma to the gum. So you find that a lot of the gum has gone down in most of the population who use that. And then other than that, the toothbrush has a wider surface, so it's able to clean a lot of teeth at the same time. Yeah. Okay. So it's really recommended to get a toothbrush.
It's not very expensive. All right. Finally, as we wind up, gum health. If somebody who maybe brushes their teeth and they bleed, is that a matter of concern? What do they need to do?
Yes, someone who is bleeding on the gums, that is an indication that you have gum disease. Yeah, so it's important for you to go to the dentist so that they're able to examine and see what is causing it. All right, there are many causes of bleeding gums. You probably have a cleaning done at the dentist, professional cleaning, which is called full mouth scaling. Yes.
All right, we're out of time. Maybe your closing comments, Dr. Mercy?
For me, I would really encourage everyone to have a checkup at the dentist. Like today is World Oral Health Day. So take your time and visit a dentist, all right? And don't be afraid. We are here to help you and to ensure that your oral cavity is clean and healthy.
Well, I'll say for many, it doesn't feel like you're there to help. It's like you literally enjoy pain, especially that machine. I don't know why it has to make that noise. A very sharp sound, but I can